Good afternoon.
Good afternoon.
Alright, so this is your speaking sub-test which is held at Tiju's Academy, dated 22nd of January 2025. Well, my name is Varsha and I'll be the interlocutor for your speaking sub-test. So, the candidate name is Aishita Lai and your candidate number is 1089. So, is it right?
Yes, exactly.
Alright, so can I just verify your ID?
Yeah, sure.
Okay.
Thank you.
So now we are proceeding with the warm-up session. So I'll be asking you a question which will be recorded but won't be assessed, and this is just to get familiarized with each other's voices. Shall I start then?
Yes, please.
Alright. Well, Aishwarya, can I just know about your typical day at work?
Yes, definitely. Thank you for the question, by the way. My typical day begins with a small prayer, then I'll go to my workstation. Once I reach my workstation, I'll take the handover from my colleagues. I'll go for the rounds with the consultant and I'll be providing the appropriate care and medications to the patient. And in between, I'll be taking small breaks and will make sure to interact with my colleagues. And by the end of the day, I'll complete my documentation and will hand over the charge to the next person. Thank you.
So thank you for that. Now we're proceeding with the role play card presentation.
Okay.
So this is your first card.
Yes.
So you'll be given 3 minutes time for your preparation and your time starts now.
All right. Thank you. So how may I address you during the time of role play?
Alright, so you can call the patient George.
Yeah, thank you. Good morning, George.
Good morning.
My name is Aishwarya. As you remember, I'm the one who was taking care of you. And I'm here to have a discussion regarding the post-operative pain relief and the further medications. So is that okay for you?
Yes.
Okay, so could you please tell me how are you feeling with respect to your pain and do you have any specific concerns, George?
Well, I was waiting for you, nurse. My wound is still really painful for me and I'm a bit concerned about the same. I feel like, this is not normal.
All right, George, I can totally understand your situation, but you don't need to worry because you are under safe hands. And I just wanted to tell you that all these things are part of your healing process and everything will be all right very gradually. So is that clear to you?
Yes, I got an understanding.
Okay, so in order to get a more clarity regarding your current situation, I just wanted to ask you, are you doing any kind of physical activities nearly?
No, no. So I haven't been doing any sort of physical activities. I was lying in my bed, very calm.
And George, I really appreciate you for being honest, but I just wanted to tell you that it's very important to proceed with some kind of physical activities because that will definitely help you to elevate your pain and will help you with your healing process as well. Because while doing a physical activity, that will improve the blood flow and reduce the risk of blood clots as well. So is that clear so far?
Yes, yes.
Okay, so on that note, I'll recommend you to go for at least 30 minutes of daily walk. Will you be able to do that, George?
Yeah, sure, nurse. So I'll try to do the exercise that you've mentioned,
Okay.
but only if you allow me to stay on this IV morphine. I just want to make sure that my pain is under control. Will that be fine?
So Josh, I know you are concerned about this IV withdrawal, but you don't need to worry because we are having a proper procedure to manage your situation. And what we will be doing in your situation is we will be continuously monitor your morphine dosage and change it into oral form. Later on, we will replace the morphine with paracetamol as well. So your pain will be under control every time. So is that clear to you?
Yes, nurse, I got an understanding now and I'm really glad that I can stay on morphine.
Okay.
But I really don't understand the difference between this IV and oral. I don't think this oral morphine will be effective for me.
Okay, Josh, that's a reasonable question that came from your side and I really appreciate you for that because that shows your consciousness towards your health. And I just wanted to tell you that if you're following this oral morphine, that will be longer lasting in its effects and it will also provide a slower release. So it is very important for you to continue on that. And if you want to, you can have a conversation with the consultant who is on the rounds on the next ward once he come back. So is that clear?
Yeah, that sounds really good, nurse. So I'll just speak with the doctor.
Okay, so let me summarize the whole part of our discussion in order to get a better clarity for our conversation. So, is that okay to you?
Sure, nurse.
Okay, so we were having a discussion regarding the physical activity, and we recommend you to go for a 30 minutes of daily walk. Along with that, we request you to withdraw from the IV morphine and replace it with oral morphines. And we also arranged a consultation with the doctor once he came back from the rounds. So, is that okay for you?
Sure.
So, I hope I have addressed all the concerns so far.
Yes, nurse.
Okay, so if you have anything else bothering you, you can contact me at any time. I'll be there in the nurse station. I wish you a speedy recovery, George.
Thank you.